You can't rebuild a joint on a faulty foundation. Correcting the mechanics is always the first step. Once alignment and mechanics are restored, we shift to strengthening and stabilizing that joint. A misaligned joint that's also weak is a ticking time bomb. Every step adds stress. Every movement creates wear. You've probably heard of regenerative medicine to some capacity over the last 10, maybe 15 years. Once we correct the mechanics, we restore stability. What we want to do now is we want to create an ideal environment for healing. Welcome back to the Freedom Health Show. I'm your host, Dr. Matt Gianforte, and today we're going to wrap up this series on knee pain, on joint degeneration, okay? I want to shift the conversation away from pain to healing, because if you've ever been told that your knees are bone on bone, if you got a disc in your back that is completely gone, even if you've tried injections in the past, or physical therapy, or even surgery, you may not be out of options yet. See, here at LifeWorks, we take a very different approach to joint care. Our model is built around 3 pillars: correct the mechanics, strengthen the joint, and then utilize the body's healing potentials with regenerative medicine to support tissue repair and growth. This is how we've helped hundreds of patients avoid surgery, reduce pain, and return to doing the things they love to do without just masking symptoms, relying on temporary fixes. Today, I'm going to walk you through how we do this step by step. First and foremost, where we win is we look at addressing the biomechanics of how the body moves. It comes back down to the basics. Like you got to fix how the body's moving in order to take the stresses off it first, okay? So most chronic joint pain is not caused by age or activity. It's caused by years of poor movement patterns, misalignment, compensation. If your knees are taking more stress than they were designed for, they'll wear out, plain and simple. Here at LifeWorks, we start every joint case with a comprehensive biomechanical evaluation. We don't just look at your knee, we assess the entire kinetics chain, how your feet strike the ground, how your hips and pelvis move, your posture, your balance, walking patterns, muscle activation and compensation. Studies published in the Journal of Biomechanics and Gait and Posture, they confirm that joint degeneration often begins with abnormal loading, especially when the hips, core, or weaknesses or imbalances happen in your pelvis. These dysfunctions increase the stress on the knees and accelerate cartilage breakdown. This is where using chiropractic adjustments, manual therapy, and corrective exercises, we can restore the alignment and train the body to move more efficiently again. So why does this matter? Because you can't rebuild a joint on a faulty foundation. Correcting the mechanics is always the first step. Once alignment and mechanics are restored, we shift to strengthening and stabilizing that joint. A misaligned joint that's also weak is a ticking time bomb. Every step adds stress. Every movement creates wear. And our job is to build a foundation of muscular support that supports and absorbs the shock and stabilizes that movement. This phase focuses on personalized physical therapy and strengthening. You see, muscle reactivation, especially in the glutes, hams, and quadriceps, are very critical. Core stabilization, functional movement, retraining, rebuilding the balance and proprioception of the body. Research in osteoarthritis and cartilage has shown that an increased quadriceps strength is directly correlated with reduced pain and improved joint integrity in patients with osteoarthritis. At LifeWorks, we tailor every plan specifically to each individual. We're not doing generic rehab. We are training the body to function at its highest level, so joints can stop breaking down and start building back. And the best part, many patients find that they regain strength and stability and their pain begins to fade. But it's because we're not masking the problem and we're getting to the root cause of the problem. Now, let's talk about one of the most exciting parts of our approach, and that is regenerative medicine. You've probably heard of regenerative medicine to some capacity over the last 10, maybe 15 years. You see, once we correct the mechanics, we restore stability. What we want to do now is we want to create an ideal environment for healing. And this is where we use regenerative therapies, right? At LifeWorks, we utilize several advanced options designed to activate the body's natural healing systems. One being platelet-rich plasma, or PRP. This is created by your own body We take your blood out, we spin it down, and we concentrate the platelets and growth factors and the healing proteins, and we re-inject them back into areas that don't have a high quantity of this, right? And it stimulates joint repair. Studies in the American Journal of Sports Medicine show that PRP can outperform steroids and hyaluronic acid in improving pain and function in knee osteoarthritis without long-term damage. Other advancements in joint regeneration are cellular allograft tissues. These are derived from donated human tissue, and they contain signaling molecules, growth factors, scaffolding proteins that can help to guide tissue regeneration. While these aren't live stem cells, they send the right signals telling your body to repair and rebuild. In 2020, the review in Stem Cells International noted that the ability of these products to modulate inflammation and improve tissue repair, particularly in osteoarthritic joints, have been amazing. Another biologic signaling compound are peptides. Peptides like BPC-157 and thymosin beta-4. They can accelerate soft tissue healing, reduce chronic inflammation by supporting angiogenesis, reducing fibrosis, and enhancing cellular repair. You see, when pairing this with nutritional support, these biologics, these help create a healing environment systemically throughout your body and not just even locally at the joint, so you feel better as a whole. Together, these regenerative tools do something very powerful. They reactivate the healing in the tissue, and it slows down the breakdown that's been happening for years. So instead of replacing the joint, we're giving the body what it needs to repair. So first we correct the joint, then we strengthen and support it, then we finally stimulate the healing using your body's own regenerative capabilities. So this is true for any joint in the body. And we're restoring the joint function and not just managing symptoms. You know, here at LifeWorks, we help people all the time cancel knee replacements, cancel surgery, get back to doing the things they love to do. We've seen people return to hiking, running, playing with their grandkids, not because we gave them a miracle, right? But it's because we gave their body the tools it needed in order to heal. The current system, it just treats the pain, the knee pain, the joint pain, and it kicks the can down the road to joint replacement. It's like a downward slope. Meds, injections, surgery, rinse and repeat. We see it differently. We see it as a puzzle with movement, strength, and cellular healing as a key piece. We are ready to rebuild instead of replace that joint, to restore instead of manage. We're here for you. See, if you're looking for help, if you want help with this roadmap to get your life back on track again when it comes to joint pain, or maybe you're somebody that's like, hey, I know my family has a history of joint pain. I need to start being proactive, which I recommend everybody doing. Maybe you have athletes in the family, right? Maybe you've got kids in sports. Hey, when do you think is a good time to start managing their joints? That's now, at an early age. Hey, thanks for joining me on the Freedom Health Show. I'm Dr. Matt. Take control of your health. Think differently. And remember, you're made to move. And if you're ready to take the next steps, check us out on LifeWorksKC.com. And remember, you can always follow us at on Spotify and on Apple Podcasts. Have a good day.